delay. So this is the SKYCSRAPER trial, which was a phase 3 trial that looked at atezolizumab, etoposide, carboplatin with or without a new drug, which is tiragolumab, in untreated extensive small cell lung cancer. So in extensive stage small cell lung cancer, we know that the current standard of care is the IM Power 133 and the Caspian trial, which used durvalumab. Here in the IM Power 133, atezolizumab, when added to chemotherapy, improved the overall survival. It was 12.3 months versus 10.3 months. It's a small increase of 2 months, but in such a lethal disease, 2 months makes a big difference. So the investigators of this trial wanted to improve this. Can we go beyond 12 months? Could you improve survival? So one of the newer immune checkpoint targets is the TIGIT, which is a T-cell immunoreceptor with immunoglobulin ITIM domain, which is another immunoregulatory ligand similar to PD-L1, which causes a disruption of CD226, which helps cancer cell escape immune surveillance. So this TIGIT was researched and they developed a molecule which is tiragolumab, which is an immune checkpoint inhibitor that binds to this T-cell immunoglobulin and TIGIT. So this is one of the newest immune checkpoint inhibitors. So this SKYCSRAPER trial enrolled patients with extensive stage small cell lung cancer along with brain mets, with or without brain mets, both were included. And they received the IM Power regimen in the standard arm, which is ETI, carbo, and etoposide. And the experimental arm had an addition of tiragolumab, which is given every 3 weeks, and maintenance was given as well after chemotherapy. The main primary endpoint was OS and PFS in the primary analysis set. The primary analysis set consisted of patients without brain metastasis. Patients were stratified based on their performance status, presence of brain metastasis, and LDH levels as well. So this trial now reported the progression-free survival as well as the overall survival. If you look at the baseline characteristics, they were well matched between both arms. We had 25% Asian representation, which is not bad. We had LDH less than upper limit of normal in 40%, which tells you 60% were patients with more aggressive disease. And brain metastasis, we know the theory, 20% of patients can have upfront brain mets. This trial also had a similar number and they were included. But when we come to the results, the PFS, as you can see, both curves are hugging each other. There's not much of difference. The median PFS is 5.4 months versus 5.6 months, not significant, obviously. And the interim OS also is almost kissing each other. And you can see that the median survival was 13.6 months, which is very similar to the IM Power 133. So this tells you that the ETI, carbo, and etoposide combination will give you a survival of around 12 to 13 months. But the new drug, tiragolumab, did not improve outcomes. The authors looked at further cohorts, like the full analysis, all the patients together, including all the brain mets as well. Here also there was no difference in PFS and OS. And if you look at the subgroup analysis, this again the authors tried to tease out something positive from this trial. But unfortunately, all the subgroups also did not show much of benefit with the use of tiragolumab. This is again the subgroup with brain metastasis. Here also not much of difference in overall survival. There was a slightly better response rate of 5%, but again that is not significant. And if you look at the safety analysis, the drug was safe. When you compare with the control arm, almost the side effects remain the same. And if you look at the immune side effects on the right-hand side of the screen, you can see that the side effects are slightly more with tiragolumab, but very less, very slight. You have immune-mediated rash, which is slightly more hepatitis, and so on. So overall, to conclude, the author said that the addition of this TIGIT inhibitor, which is tiragolumab, did not improve the outcomes in patients with extensive stage lung cancer with when you combined it with atezolizumab plus chemotherapy, there was no improvement of PFS or OS. The tolerance of the molecule was pretty okay. It's not very toxic, but efficacy is not there. And this again shows you that the IMpower 133 is the standard of care currently in extensive stage small cell lung cancer. You also have durvalumab in the Caspian trial. There are further studies going on using these TIGIT inhibitors in other types of lung cancer, like non-small cell lung cancer, in both the metastatic setting as well as the adjuvant and neoadjuvant setting. So definitely there is some new data which is going to be coming out. And this drug is owned by Roche. You have other TIGIT inhibitors which are in the pipeline from various other companies as well. So this is the next area which is going to get targeted, again going to make things more confusing in the immunotherapy sector. So as of now, there is no particular benefit in small cell lung cancer. We have to wait for the results in other types of lung cancer. Thank you.